1970, and the pill had come out in 1960. And even in 1970 in the UK, you couldn't get the pill, you couldn't be prescribed the pill if you're unmarried. And it seems almost unthinkable now, but that was 10 years after it came out. And there was an organisation called the Brook Street Bureau, which sounds like a sort of advertising company, but they provided advice to unmarried girls if they want to take the pill. People used to come in and say, what are the effects? Will I get this? Will I get that? And I said, don't know. And I realised that as an epidemiologist, one could start answering those questions. So that's my own career. But it also, I think if you look back, in some ways for women's lives, the pill has been one of the most important public health developments, contributions, whatever you want to call it, for women. The whole, if you look at the women's movement, if you look at women's lives and everything, it's really the pill that changed things around. And so I would put that high, I would put that really on the top. I think in general things have got much better. I think research, knowledge about the cause of disease, way of preventing disease, has grown enormously since the 70s. When I first started in 1970 in epidemiology, if you leave out communicable disease, where people had really pre-war sorted out a lot of communicable disease, vaccines and so forth, and there was the beginning of the epidemic of heart disease, cancer and so forth. And I think when I started in 1970 in epidemiology, I could have read every article that was ever written on the topic. It was so few. And and there was not much data around. In fact, the main thing papers coming out was about smoking, about the adverse effects of smoking. And now the literature is absolutely full, far too much, and some of it's not terribly good, but the main messages have come through, and particularly I think the importance of smoking still remains. And so in general it's better because there is a lot of evidence. There's been a bit of a tendency, I think in the UK, to ask independent people who are management consultants, who really don't know the topic very well, to write a report. And I think the government's increasingly relying on these management consultants to review the evidence. It's superficial a bit. It doesn't really understand where the problems are. It's the kind of conventional view of a quick scan of everything that's been said, but it's not necessarily the wisdom and the depth that's lacking. And I think that's the way government is going a bit, I think, is to rely on non-experts to do a quick summary. And I think it's partly because there was a little bit too much self-promotion from experts, which is a real pity. I mean, I still get the impression that governments make pretty good decisions and do really require quite concrete evidence before they start new programs or something. They tend not to rush in, and I'll actually make a contrast. In health in general, government health programs are pretty good, but for education, for example, there's almost no equivalent data, and keep chopping and changing. There's always another policy, whereas really education and health really are quite contrasting in that way, in that there is a wealth of data. And mostly I think governments and government advisors that I know in the UK, here, Europe, are pretty, on balance, pretty sensible.